We'll now move on to orders of the day with oral questions put by members to ministers. The official leader of the opposition. The leader of the official opposition.
Mr. Speaker, I'm not even sure I feel like doing this today. It's a pretty tough moment to follow. But I have a question for the Premier. Mr. Speaker, yesterday the Premier kindly and politely encouraged me to table any information that we have on the benefits of the film tax credit. So I am tabling today a number of documents. The first one is the Canadian Media Production Association report entitled Profile 2014 Economic Report on the Media Production Industry in Canada. I also wish to table the Film and Creative Industries Nova Scotia Accountability Report for 2013-2014, Mr. Speaker, from the Premier's own Film Nova Scotia. And finally, I wish to table testimony given by the CEO of Film Nova Scotia to our own legislature's Economic Development Committee a month and a half ago in response to a question from a member of the Liberal caucus. Mr. Speaker, all of these documents confirm that although the cost of the film tax credit to the government is in the $22 million range, that it returns in direct investment in our province each year between $120 and $140 million. So, Mr. Speaker, in light of the fact that the benefit of the film tax credit to the economy of Nova Scotia is at least 5 times the cost, I would like to ask the Premier to assure those Nova Scotians that work in our film and creative industries that that tax credit will still be in place next year.
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable member for the question and for the information that he's tabled here today. Mr. Speaker, the numbers that the leader of the Conservative Party is using is numbers that are associated with the entire production industry in the province, even those that do not qualify for the tax credit. But we will take the information that the leader has provided. I know that the minister would have received some of that as well. And, Mr. Speaker, we'll wait for Budget Day.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. I'm glad we're coming to some conclusion on the numbers, but of course this is a story about more than just numbers, Mr. Speaker. There are homegrown success stories in our film and television industry here in Nova Scotia. One example is Arcadia TV and its president, John Wesley Chisholm, who I believe is in the building at this time. They are a successful Nova Scotia company employing 30 people here in the province of Nova Scotia. Right now, they are busy scheduling summer productions. All of that work, Mr. Speaker, has been put at risk because of the uncertainty created by the comments of the government about whether there is any value to the film tax credit or not. I'll ask the Premier, will he end the uncertainty today and assure Mr. Chisholm and his employees that they can continue to bring film and TV work to the province of Nova Scotia with confidence that the film tax credit will be there for them?
The Honourable Premier.
Speaker, I want to thank Mr. Chisholm and all of those who have believed in the province of Nova Scotia, invest in this province. Mr. Speaker, I want to thank all of the hard-working Nova Scotians who day in and day out go to work and contribute to the economy of this province. As all members of this House know, we have financial challenges facing this province. We're looking at all possibilities to make sure that we are spending tax dollars the best possible way to drive economic development, Mr. Speaker. We'll continue to do so. Next Thursday, the minister will stand up, deliver a budget that is focused on the future, Mr. Speaker, and I'll be glad and very proud to stand here with her as we deliver and chart a course forward for this province.
The Honourable Leader of the Official Opposition on his final supplementary.
Thank you, Mr. Speaker. We all understand the financial challenges that the province faces and the need to make changes. But I'm sure that small business owners like John Wesley and others would agree that so far the only change that we've seen is that instead of the NDP giving away millions of dollars to the Irvings, we have the Premier giving away millions of dollars to the Royal Bank, but then telling companies like Arcadia TV that they can't go on to support them. Mr. Speaker, that's not the change that Nova Scotia needs. It's great to thank them for the work, but how can the government say that they support our homegrown success stories like Arcadia TV when they go out of their way to create such turmoil at a critical time in the film and television business?
The Honourable Premier.
Mr. Speaker, first of all, it's glad to know that the leader of the Conservative Party of Nova Scotia is against good-paying jobs through payroll rebates that are coming here, Mr. Speaker. The fact of the matter is, Mr. Speaker, that a company that has a global footprint chose Nova Scotia, Mr. Speaker, because they believe in this province, they believe in the workers, and they believe in the workforce. It's unfortunate, Mr. Speaker, that the leader of the Conservative Party is opposed to that and sending a negative message outside of this province. Mr. Speaker. And Mr. Speaker, what's the real challenge here, Mr. Speaker, is the uncertainty that is being spread by the leader of the Conservative Party. The finance minister spoke, Mr. Speaker, that change is required. She'll deliver a budget, Mr. Speaker, that will show change and chart a course in a direction to move this province forward, Mr. Speaker.
The Honourable Leader of the New Democratic Party.
Thank you very much, Mr. Speaker. Mr. Speaker, my question for you is to the Premier. Mr. Speaker, intensive care beds at the province's only tertiary hospital are closed, and critical care nurses are being asked to care for twice the number of patients they normally would. Travel nurses are being flown in to work in our hospitals from out of province. And yesterday, during question period, when I raised concerns about patient care and safety with the Premier, he suggested if I had issues with this, I should take my concerns to the employer, the new Nova Scotia Health Authority. Mr. Speaker, can the Premier please explain why he thinks it's not his responsibility to address the issues I've just described?
The Honourable Premier.
Thank you, Mr. Speaker. Not only are we addressing that issue, Mr. Speaker, we're dealing with all of the unfinished business that the former government ignored, Mr. Speaker. We brought in essential service legislation to ensure that health care would be there for Nova Scotians and not brought to the brink every time there's a labour disruption. Mr. Speaker, we brought clarity of taking 50 collective agreements down to 4, Mr. Speaker, so that we can go to the bargaining table and negotiate on behalf of all Nova Scotians for a free and open collective agreement, Mr. Speaker. Mr. Speaker, what we've said, if there are issues on the floor, is that when it comes to staffing, I encourage the staff to go to their employer to work with that. Mr. Speaker, we know across this province the staffing level will be different on every floor because of the acuity of the illness that is being looked after, Mr. Speaker, but the simplistic fix that the leader of the Democratic Party is talking about does not work. She knows it doesn't work, and that's why she didn't implement it when she was the health minister.
The Honourable Leader of the New Democratic Party on her first supplementary.
Thank you very much, Mr. Speaker. Mr. Speaker, everyone knows that every government leaves office with unfinished business. This government will leave office sometime very soon with unfinished business, Mr. Speaker. My concern is that this government is creating new problems, worse problems, that weren't there under the former government. So, Mr. Speaker, yesterday during question period, the Premier was boasting about the number of nurses currently in the system, and it's a good thing, because imagine what things would be like if even more nurses left. Even with the complement of nurses, we know ERs are closing in communities around the province due to shortages, including in Shelburne. So my question to the Premier is this: why won't he admit we have a shortage of nurses, and when will we see a plan to address this issue?
The Honourable Premier.
Mr. Speaker, the only time since 2008 that we've had a reduction in registered nurses in this province from one year to the next is when that member was the health minister in this province, Mr. Speaker. We have more registered nurses in this province today than ever in our history. We have more licensed practical nurses in our province working than ever in our history, Mr. Speaker. We've hired 90% of the graduates, Mr. Speaker, in nursing schools. 90% of them, the highest number we've hired in the history of our province to work here. Are there challenges? Absolutely, Mr. Speaker, and we're going to be there to work side by side with frontline healthcare workers to continue to improve the healthcare system for this province, for all Nova Scotians, Mr. Speaker.
The Honourable Leader of the New Democratic Party on her final supplementary.
Mr. Speaker, during the time I was health minister, ICU beds never closed, and we never had to bring nurses in from other provinces, Mr. Speaker. Mr. Speaker, people who depend on the Roseway Hospital in Shelburne have seen emergency room closures increase by nearly 800% due to a shortage of nurses in the past 6 months. And Mr. Speaker, the McNeil government has put incentives in place to attract doctors to underserviced communities. So my question to the Premier is this: will the Premier put incentives in place for nurses so they will go to communities like Shelburne where there is a nursing shortage.
The Honourable Premier.
Mr. Speaker, we're going to continue to do what the Minister of Health has been doing and working with health care providers from one end of this province to the other to ensure that the health care teams are there to respond to the needs of specific communities, Mr. Speaker. The Minister of Health has been doing a tremendous job on behalf of the citizens of this province. One thing that did happen, Mr. Speaker, that is clear, when that member was a health minister and part of a government, they gave a 7.5% pay raise, Mr. Speaker, to civil servants in this province, Mr. Speaker, when the economy was the worst performing economy in Canada, and we were paying more than any other jurisdiction in the entire country, Mr. Speaker. So what they decided to do, Mr. Speaker, was throw more money at the union leadership, Mr. Speaker, instead of ensuring that the services were in place for communities across this province so that Nova Scotians could access that service, Mr. Speaker.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. Small business owners in Nova Scotia are worried that the Premier is about to raise their taxes too. His own tax study recommended that the small business tax rate be increased by 5%, or almost triple its current level. Mr. Speaker, when in opposition, the Premier said, and I quote, "Our small business tax is too high, and we start collecting it earlier than our neighbours." Does the Premier stand by what he said in opposition, and will he assure small businesses across Nova Scotia that he will not raise their taxes next week when the budget is tabled?
The Honourable Premier.
Thank you, Mr. Speaker. Mr. Speaker, I'm very proud of the work that I did in this House, on both sides of the House, Mr. Speaker. I'm very proud of the fact that I've been very direct with Nova Scotians. I told them exactly, Mr. Speaker, the direction our government is going to go, and I will continue to do. What I've always done, Mr. Speaker, is keep my commitments and my word to the citizens of this province, Mr. Speaker, but I encourage the Leader of the Conservative Party to wait till next Thursday when the budget is introduced.
The Honourable Leader of the Official Opposition.
Mr. Speaker, our neighbour is New Brunswick, and despite the financial challenges there, the government of New Brunswick is investing in small businesses by actually lowering the small business rate in the province of New Brunswick, which will directly compete against the small businesses here in Nova Scotia, who are relying on the Premier to keep his word in opposition that he believes their taxes are already too high and should be lowered and not raised. Mr. Speaker, the government has ruled out several items from next week's budget, but refuses to rule out an increase in the small business tax because their own study recommends it. Mr. Speaker, which statement does the Premier agree with? The one he made in opposition, or the recommendation to increase small business taxes as made by his own tax study?
The Honourable Premier.
Mr. Speaker, first of all, I want to thank the people who worked very diligently on behalf of the citizens of this province to deliver an independent study on taxation and regulatory reform in this province. It's like all information that's brought to the government. We look at it, analyze it, Mr. Speaker, and then chart a course going forward. I want to remind the Leader of the Conservative Party that the small business tax rate in this province is lower than it is in New Brunswick, even with the changes that took place. We're continuing and going to continue to partner with small businesses across this province to drive economic opportunities for citizens and to drive economic growth so that we can afford the programs and systems that we as Nova Scotians have become accustomed to.
The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Speaker. Yesterday I asked the Minister of Health to provide the contract for the travel nurses who are coming from outside the province due to the shortage in critical care units, nurses for critical care units at the QE2, and his response was to wait for the budget estimates. Mr. Speaker, this contract has absolutely nothing to do with the upcoming estimates. This government is about to introduce next week. So my question to the Minister is, why is he avoiding producing the travel nurse contract? What is he trying to hide, Mr. Speaker?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and certainly that information can be made available. However, I have found during estimates a time when many of the matters that affect the health budget of the province, both when I was in opposition and last year as minister, it does allow those longer discussions to be able to drill down, and that is one of those figures that can be discussed at that time.
The honourable member for Sackville-Cobequid on his final supplementary.
So I guess my last comment was correct, Mr. Speaker. He's hiding behind it. He just indicated that it can be released, but he's choosing not to, which I don't understand. I mean, he should be transparent. The government has committed to being transparent to Nova Scotians. So I'd like to ask the minister again, why wouldn't he provide that information today?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. As we know, that contract and that work was started under Capital Health, now the Central Zone, and as we know, the new health authority in getting underway may have those figures available. But we know that work is pretty intense at the moment. But what I can assure is over the next while, the member for Sackville-Cobequid will get that information.
The honourable member for Pictou East.
Thank you, Mr. Speaker. My question today is for the Premier. Well, in opposition, the current Premier announced the Liberal plan for a February holiday. With that, he said he would help small business make up for any lost revenue due to the holiday closure. In fact, he told reporters that lost business revenue would be offset by other Liberal measures that would stimulate business activity, including a proposed cut to the small business tax. Flash forward to 2015, the Premier got his holiday, and he just told this House that he always keeps his word. So now will he keep his word and cut the small business tax?
The Honourable Premier.
What's that? Thank you, Mr. Speaker. Like all taxes in the province, the small business tax is being reviewed. It'll be part of the budget going forward, Mr. Speaker. We will lay out a chart of course going forward. Mr. Speaker, we've been very clear and direct with Nova Scotians. They've responded very positively to our government. We're encouraged by the fact that so many Nova Scotians want to work with us to move this province forward, despite the negativity coming from the Conservative Party in this province.
The honourable member for Pictou East on his final supplementary.
I'm not quite sure who the Premier is consulting with, but there's not a lot of Nova Scotians that I know that are anxious to pay more tax. And the Liberal Commission Broughton report calls for a 5% increase in the small business tax. So after promising that the February holiday would be accompanied by a tax cut, it would be cruel to instead add 5% to these small businesses. So which is it, Mr. Premier? Cut the taxes or raise them?
The Honourable Premier.
Mr. Speaker, the member opposite does his best, along with the leader, to continue to go around and send fear in communities that all this is going to happen without any basis for it, Mr. Speaker. They stand up in this House and they tell us to balance the budget in 1 year, Mr. Speaker. Then they say, oh, by the way, don't cut anything, and specifically don't cut anything out of Pictou County, for God's sakes, Mr. Speaker. And he stands up time after time. They can't have it both ways, Mr. Speaker. They can't have it both ways. Leadership is about sending a direction for this province. We're going to send a direction, and Nova Scotians are joining us and moving forward and leaving you behind.
Just like to remind the Honourable Premier not to use the word "you." The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. Where have we heard that before? Mr. Speaker, my question through you is to the Minister of Health. Mr. Speaker, earlier this week, the CEO of the new Provincial Health Authority, Janet Knox, was interviewed by All Nova Scotia, and she said that she implemented changes at the Western Kings Memorial Health Centre in Berwick back in September 2011 that could be a template for the new Provincial Health Authority. Now, Mr. Speaker, I don't know if you're aware, but back in 2011, in opposition, the now Minister of Health on this side actually organized a public meeting and invited Ms. Knox to it with the hope of getting her to change her mind about introducing the changes of which she spoke at the Western Kings Memorial Centre. And I'll table that at the end of my question. So my question to the Minister is this. Does he now agree with the model that's being considered for the Nova Scotia Health Authority that he didn't agree with in 2011?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. As the member opposite knows, that anytime a change comes about and there is a new model, there is aspects of the clinic and the clinic hours now at Western Kings Memorial that is serving the public very well. Now that the new health authority has officially started, we will do that health services plan, that clinical review, and Western Kings Memorial will in fact be part of that review.
The Honourable Leader of the New Democratic Party on her final supplementary.
Thank you very much, Mr. Speaker. Well, Mr. Speaker, when this model was being implemented in Berwick, which included a reduction in hours at the clinic, the now Health Minister said, and I quote, "We're simply not prepared to let this issue go," and he requested an emergency meeting with the Minister of the day in the hopes that the Annapolis Valley District Health Authority would reverse its plan. And I'll table that newspaper article, Mr. Speaker. So my question for the Minister is, when exactly did he see the light and change his mind about what was going on in 2011?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. As I said, you know, it has aspects of a good model of care. We know now that there are surge times during the year when the Valley Regional ER does have pressures, and as part of the clinical review, Western Kings Memorial, indeed all of our health centres and our regional sites will in fact get that intensive look as to what services we will provide from one end of the province to the other.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. When the Minister of Health moved second reading of Bill 60, he exempted menthol-flavoured tobacco products because it has been on the market for decades and it is not marketed to youth. And I'll table number 1. On November 14th, the minister said that he would consider bringing forward legislation that did not exempt menthol. And I'll table number 2. So my question to the minister, will the Minister of Health confirm today whether menthol cigarettes will be exempted from the legislation that he said he would bring forward during this session?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. The member for Argyle Barrington this morning is asking questions like we get from the media. He wants to preempt the bill that's going to come forward. I will say very directly to the member opposite, the session is far from over.
The Honourable House Leader for the Official Opposition on his final supplementary.
Well, the Minister of Health has had no truer words than that is far from over. But quite honestly, Mr. Speaker, I think it's a valid question that we did have a long debate on flavoured tobacco and other things during the last session of the House. And there was the big issue that the Canadian Cancer Society brought forward on menthol is a kiddie flavour. 1 in 3 Nova Scotia youth smokes menthol cigarettes, a much higher rate than the Canadian average for all smokers. And that's in this document as well. And I'll table that as well. So while the minister might believe that menthol products are not marketed to young people, it is young people that are certainly using them. So my question to the minister, what steps is the minister taking to ensure that smoother flavoured menthol cigarettes are not the first smoking experience for Nova Scotia youth?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and very, very pleased with the work of Dr. Strang and the Department of Wellness and the level of consultation that has gone on over the past 3 months. We have a very, very clear picture now around the e-cigarette and how that is being picked up, flavoured tobacco use in the province, chewing tobacco. We can keep going through the list, including menthol. And that intensive survey consultations that were done with numerous stakeholders, our legislation will reflect the voice of Nova Scotians.
The Honourable Member for Sackville-Cobequid.
Thank you, Mr. Speaker. The Dartmouth General Hospital is constantly overcrowded and important medical procedures and surgeries are being cancelled as there are no beds available. Doctors at the hospital readily admit to using every nook and cranny to treat patients. Last April, the Minister of Health announced $7 million for renovations to the hospital, but this money did not include the current empty 5th floor. So I'd like to ask the Minister, why did the Minister not include the empty 5th floor in the renovation and upgrading investment made last year?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And we are pleased as a government to be responding to the Auditor General, and that is first and foremost on the 3rd and 4th floor, making sure that infection control is at the standard that it should be for the Dartmouth General. That work is well underway. I've signed off on that work for the 3rd and 4th floor, and we were told at the time that engineering was giving us the picture that work would need to be done on the 3rd and 4th floor before work could actually even start on the 5th floor, because there has to be some structural changes to the Dartmouth General.
The Honourable Member for Sackville-Cobequid on his final supplementary.
Thank you, Mr. Speaker. I think the patients would be shocked to know that, and the residents of Dartmouth, Mr. Speaker, would be shocked to know that when they walk into the Dartmouth General and see the overcrowding emergency room and wait times through the roof, that there is a completely empty floor being used. The Premier, the Minister, his party committed to renovating that 5th floor, Mr. Speaker. There was a plan in place to do that. So I'm wondering why the Minister threw that plan out and not continue on to renovate the 5th floor that could relieve some of the pressure that we see throughout the Dartmouth General Hospital.
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. Maybe this is a time when the member opposite and 2 former ministers of health want to totally have 4.5 years of government disappear in a flash. They had an opportunity to work on this. What I can tell the people of Dartmouth and the new Central Zone is that during our mandate we will be addressing the needs of Dartmouth General, and in particular work on the 5th floor.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. My question is for the Premier. Corridor Resources is a multi-million-dollar oil and gas company based in Halifax. The company is banned from conducting hydraulic fracturing operations in New Brunswick. They are also banned from operating here in Nova Scotia. Now Corridor is opening an office out west, concerned about the dwindling opportunities onshore here in the Maritimes. So what does the Premier have to say to the people at Corridor Resources that want to do business here but feel like they're being left behind by this government?
The Honourable Premier.
Speaker, I want to thank all those who have invested, Mr. Speaker, in the economy of the province. We're very encouraged by the work that we're seeing from BP and Shell. Mr. Speaker, the province has been chosen from a global company that's done looking around the world to where locate. They chose Nova Scotia. Those are all positive things, Mr. Speaker. Companies will look for opportunities all over the globe. They'll open offices in other places, Mr. Speaker. We, as a province, see that as an opportunity. We'll continue to work with anyone who wants to operate in this province, but, Mr. Speaker, they have to do so under the rules and regulations of the province of Nova Scotia.
The Honourable Member for Pictou East on his final supplementary.
Thank you, Mr. Speaker. The sad irony is that providing a definition of high volume might allow Corridor to do business here in this province. And yet, it's been over 7 months since the Premier banned high-volume hydraulic fracturing, and we still don't have a definition for what it means. The other day I asked the Minister of Energy for a definition, and he said work is underway to define it. Mr. Speaker, imagine how sad that is, that they ban something they don't know what it is. So today I'll ask a simple question to the Premier. Does the Premier know what high volume means?
The Honourable Premier.
Mr. Speaker, one of the challenges, Mr. Speaker, when you're in government, you have to deal with the reality, Mr. Speaker. When you're in opposition, Mr. Speaker, they create their own little reality that member seems to be living in his own little world, Mr. Speaker. The reality of it is, Mr. Speaker, we have fracking waste in this province. Is he prepared to take it in Pictou County, Mr. Speaker? Is he prepared to take the fracking waste in Pictou County, Mr. Speaker? Because Mr. Speaker, we've heard him stand up in this House on one side of vote Harper, helping us deal with that environmental problem, Mr. Speaker. We've heard him stand up in this House and tell us to close the mill, Mr. Speaker, to protect the environment. On the other hand, we hear Mr. Speaker say, don't lay them off, Mr. Speaker. The reality of it is there's rules in this province,
Order,
Mr. Speaker.
please.
You want to do business?
The Premier has the floor.
Follow the rules.
The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. Mr. Speaker, my question again is to the Minister of Health. Mr. Speaker, in the 2013 Liberal platform, this government promised to invest in services to eliminate the wait list for early intervention programs. A year after the election, the Minister of Health launched a review on autism treatment programs, and we were told the recommendations would be released late last fall. Mr. Speaker, can the Minister please tell us why parents are still waiting for the results of that review?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And the member opposite indeed talks about a very, very important program. One, in fact, that the Premier and I have been directly involved with supporting through the years, and we'll continue to support this program. And I believe it's just a matter of days before this report will be available to the public of Nova Scotia.
The Honourable Leader of the New Democratic Party on her final supplementary.
Thank you very much, Mr. Speaker, and I thank the Minister for his response. We're very much looking forward to seeing something concrete, Mr. Speaker. Mr. Speaker, this past September, the Minister told the Cape Breton Post, and I quote, that we must act quickly on improving the process for children to participate in the EIBI program. And now the Minister has delayed the release of this report, and many families continue to wait, and they're worried, Mr. Speaker. They're worried that this is going to be yet another broken Liberal promise. As one mother told the Chronicle Herald, quote, for us, that platform promise is the difference in our child's success. So, Mr. Speaker, with early intervention time is of the essence. When will the Minister live up to his commitments and eliminate the wait list for these important programs?
The Honourable Minister of Health.
Much, Mr. Speaker, and this is a program that is proving very successful before children go to school. When we had a very, very strong panel put together to take a look and review the current EIBI program in conjunction with the IWK, we've certainly at a good point in time to know that it is indeed working very, very well. And I would advise the member opposite to stay tuned for Budget Day.
The Honourable Member for Pictou Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Natural Resources. This winter, Nova Scotians face a shortage of wood pellets, which are used both as a primary and secondary home heating fuel. Many have been forced to drive from store to store looking for bags of this valuable product, which are almost nowhere to be found. My question to the Minister, has the Minister met with producers, retailers and consumers to discuss ways to address the challenges of wood pellet shortages in this province?
The Honourable Minister of Natural Resources.
Thank you very much, Mr. Speaker. To answer the question directly, yes, we have. We meet with stakeholders from that industry on a regular basis. Also, when it came to the hardwood shortage last year, our government acted immediately. We worked with our private sector partners, Mr. Speaker, encouraging them to have a greater output of hardwood into the firewood market, Mr. Speaker, and it actually produced a threefold increase in firewood supply last year, Mr. Speaker, and of course we'll keep an eye on the situation moving into next year and act again if necessary.
The Honourable Member for Pictou Centre on his final supplementary.
Thank you, Mr. Speaker, and I want to thank the Minister for that answer, and especially that he didn't refer to Pictou County in his answer. Mr. Speaker, wood pellet heat is highly regarded and is known for its efficiency. In fact, Efficiency Nova Scotia encourages Nova Scotians to buy these stoves by offering a rebate of up to $600. And I'll table that, Mr. Speaker. While Nova Scotians are being encouraged to buy wood pellet stoves, there are persistent shortages of supply. My question to the Minister, will the Minister commit to continue working with producers and retailers to work towards improving supply of wood pallets to Nova Scotia consumers so that they'll be able to take advantage of the benefits of this heat instead of having coal homes and stoves they cannot use?
The Honourable Minister of Natural Resources.
Thank you, Mr. Speaker. We take a very active role in working with our private sector partners. I want to be very clear. The majority of wood that goes out into the marketplace in this province comes off of private land, Mr. Speaker. 75% of the wood supply is coming off of private land. It does not come off of Crown. We are working directly with private woodlot owners to ensure that they have a model that is accessible and economical for wood harvesters to access, and we continue to work with all community members and stakeholders in that sector to strengthen our forestry sector and ensure that there is the highest volume of hardwood available for heating purposes.
The Honourable Member for Inverness.
Mr. Speaker, my question is for the Minister of Health. Millions of dollars are wasted each year as people wait in $1,000 a day hospital beds waiting for long-term care options. One of those options is home care. Rural home care agencies who deliver the service are facing challenges. I know in my area there's a shortage of workers. They are funded by what is known as a direct service hour, which doesn't always cover costs that would be associated with sick time, lost time due to storms. These agencies have no control over the terms of employment because they're set by government, and they don't have any control over requirements like that to have caregivers using mobile GPS and Blackberries. Mr. Speaker, money could be saved and redirected towards these agencies to better fund them. Will the Minister do that?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I'm sure the member for Inverness is well aware that we not only have a continuing care strategy that is still in the making, but more importantly, home care, home support will in fact get that very intensive look and some redevelopment through the RFP, and we want to make sure that in fact we have some leveling of the cost right across the province, that we also modernize the system as well. We now are spending excessive hundreds of thousands of dollars with mileage, for example, that does not need in some areas to be used and still be able to give good care. So this is an opportunity to realign some of that home care, home support delivery, and that's exactly what we're doing.
Honourable Member for Inverness.
Mr. Speaker, I appreciate the Minister's comments because there is a need for realignments. Mr. Speaker, on March 12th, the Minister was reported to have said that tenders will be issued to open up home care to new service providers. The next day, the Department of Health corrected that statement to say that it was not happening. There's a lot of uncertainty out there. Changes need to be made. There's a sense, I think, by people who are volunteering in this sector, as board members and whatnot, that maybe government is not listening to the situations they're facing. My question is the Minister really working with existing rural health home care agencies to understand their needs, or have they been set up to fail?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and the member for Inverness asked an excellent question. In terms of what was reported in the newspaper, it sounded as if that the RFP was coming out right away, and what the department was saying, no, it's still a work in progress. We've brought in the vendors, and probably by fall we will have the RFP ready to go out. But he also makes a really good point around the fact that some agencies now, in fact, are doing some of the kinds of things that we actually need to be doing right across the province. They have reached a very, very high level of efficiencies, and we will have to look at that and embrace good work where it exists. And so while there may be a bit of uncertainty, one thing we know for sure is that every home care worker in the province will have an opportunity to work in home care.
Just before we go on to the next question, just for those keeping track at home, the QP will conclude at 11:06. I don't think I mentioned that when we started. So 11:06, we'll finish. The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. Mr. Speaker, representatives of the film industry left their meeting with the Finance Minister last week convinced that their sector is a complete mystery to the Minister and to senior bureaucrats in her department, who have no understanding of the benefits, economic, cultural or promotional, of their sector. So let me help the Minister and her Premier better understand the film and TV industry. Trust and confidence are extremely important to create a thriving and successful film and TV industry. Anything that creates uncertainty sends producers with their much-needed investment dollars to a more competitive jurisdiction. So I ask the Minister if she will provide assurance to the creative industries today that she will not make Nova Scotia a less competitive place for this very fluid but lucrative industry.
The Honourable Minister of Finance.
Thank you very much, Mr. Speaker. And again, the member opposite in her question refers to the meeting that we held. We had a good meeting. The representatives of Screen Nova Scotia were able to raise their points. I think that there's somewhat of a difference of opinion between the two because we look at it from a fiscal responsibility point of view. We look in our department at how much money is returned to the provincial revenues of the province from every industry that we support. And, you know, we agreed that we would continue to talk, that there would be future meetings. So, Mr. Speaker, we are not finished talking and discussing with the industry.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. And I'm glad to see the members of the opposite side of the House so enthusiastic about possible changes to the film and television tax credits, because I'm sure they are hearing from many people in their constituencies about their concerns for what's going on and hoping that nothing will change. But in an email to all Nova Scotia, a spokesperson for the Finance Minister actually said that she's reviewing the film tax credits so that the province will be better able to seize opportunities for a future here for young people. So I would suggest that the government's already sent a message to young people in Nova Scotia when they cut the graduate retention rebate, and I hear are now planning to lift caps on student tuitions as well. So my question for the Minister is this: does she understand that weakening the film tax credit will in fact exile an enthusiastic, successful, growing creative sector made up of young people who want to stay in Nova Scotia and earn a decent living in the creative economy?
The Honourable Minister of Finance.
Thank you very much, Mr. Speaker. And again, you know, I appreciate the question, and I know there's a lot of interest and anxiety because a budget is coming. Earlier today, we heard other questions around other taxes that are of concern to Nova Scotians. But, Mr. Speaker, as the Premier said earlier, my message has been clear. We're a province that has been in deficit for 20 of the last 30 years. We are carrying a deficit, you know, of millions of dollars, multi-millions of dollars, and we have to look at every dollar that we put out to support industry of any sort and see how it returns the benefit to the province. So every tax credit, all of the benefits that are available to business have been on the books this year. It's been no secret. We've been public about that. Thank you, Mr. Speaker.
The Honourable Member for Colchester, Musquodoboit Valley.
Thank you, Mr. Speaker. My question is for the Minister of Transportation and Infrastructure Renewal. I want to go where no man has ever gone before and ask a question on roads. I've had a number of calls in my constituency, of course, concerning the storms and the roads, and we all have had those calls. I just want to narrow in on one particular concern. People are losing 2 and 3 days of work, and some are concerned about being able to get out to a doctor or getting emergency services in. So my question is there a time frame for when the roads should be cleared and open?
The Honourable Minister of Transportation and Infrastructure Renewal.
Thank you, Mr. Speaker, and I thank the honourable member for the question. Certainly, This has been an issue. It's been a very challenging winter for the department, for all Nova Scotians, for our municipal partners as well. The snow clearing has been a tremendous challenge with the precipitation, the change in weather with temperatures. So it's certainly been tough, and I know that the member and all members of the House have been hearing from constituents, particularly on rural and remote areas where the roads are just very difficult to get to. The way these standards are built is that it's an 8-hour window for all 100 series highways, 12 hours for the secondary roads, and 24 hours for the rural roads. That's been the standards, and it's basically for 99% of the storms. So all things being equal, we can get to those roads within 24 hours. There's certainly been significant challenges this year, but with the amount that we've spent, we're ranging in about $75 million for the annual budget. We do our very best, but obviously there will be some lessons that we'll try to get from this winter and continue to work hard. But as I said to the member before and all members of the House, these individual situations, we certainly want to hear from the MLAs and do what we can as a department. So thanks.
The honourable member for Colchester, Musquodoboit Valley.
Yes, I was just being concerned about the ones that are, for instance, losing 2 and 3 days without being able to get out. So my question is it possible for the roads to be given one swipe in order just to open the road and then have folks go back in, do a proper job later? That was one suggestion given to me, either by municipal gear or by private gear.
The Honourable Minister of Transportation.
Thank you, Mr. Speaker. And look, that is a reasonable question. I think what we're going to do, we'll do a post-study of this whole winter, and Barb Bailey at Operations has been tremendous on this work. And I think that to the member's question, there haven't been a whole lot of concerns and requests from the department about people who have been stranded for that number of days. Certainly, regardless of the weather conditions, 2 or 3 days to wait is a very long time for medical needs, for work, employment, school, those types of things. So I think what we probably do is look at that on an individual basis, Mr. Speaker, and I appreciate that question. If the member wants to bring those specific roads forward, we'll certainly have a look. Thank you very much.
The honourable member for Sackville-Cobequid.
Thank you, Mr. Speaker. The overcrowding of our hospitals is a serious issue across the province, not just here in Halifax and Dartmouth. Hospitals all over, such as the Valley Regional Hospital, are experiencing situations where surgeries are being cancelled, when surgical beds are being filled with medical patients. So I'd like to ask the Minister, could the Minister provide this House how many surgeries have been cancelled at the Valley Regional Hospital since January 1st due to the overcrowding situation at that hospital?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And in relation to the figure, I'll have to have the department provide that. I know there have been some days when, of course, a number of factors, and especially we had winter storms that, in fact, kept patients from being able to get to their surgery. So we have different reasons for cancellation. We are now at a wonderful opportunity with the new health authority to be able to take a look province-wide at the integration of the system, because what happens in the ER is really that microcosm, that place of entry into the system that's in fact affected by, as we know, flow through a hospital, and also there are occasions when in fact we could avoid somebody coming to the ER altogether. So this is a great time now to look at what we can do in other parts of the province to take pressure off the QE2 and regional hospitals where most entries of EHS occur.
The honourable member for Sackville-Cobequid.
Thank you, Mr. Speaker. Documents obtained by the NDP caucus through Freedom of Information show that on March 5th, the Valley Regional Hospital was so overcrowded that the emergency department was advised to avoid overnight observation of emerge patients where possible. And I'll table that, Mr. Speaker. Mr. Speaker, how can Nova Scotians have confidence in the healthcare system when their emergency departments are so overcrowded that doctors and nurses are being advised to limit who is being observed overnight in the ER?
The Honourable Minister of Health.
As the former Minister of Health knows, that there are those surge points, there are those pressure times due to extreme conditions that are sometimes relating to seasonal events. We know this year, for example, that the flu was considerably more serious than we have had in recent years, even during the H1N1, because the vaccine that year covered H1N1. This year, we only had about a 30% coverage of flu viruses. From the high percentage, in fact, of Nova Scotians who get the flu, but if the flu shot is the vaccine wasn't the best selected by the World Health Organization, we know that, in fact, more cases of flu and with elderly people. And the member opposite is talking about one of the areas, in fact, of Nova Scotia where we have, in fact, 5 communities already with 25% of their population over 65 years of age, and we know that that puts extra pressure on the ER. And what I can tell the member opposite is that we are going to listen and act on the advice of Dr. David Petrie, Dr. Sam Campbell, and we'll have a plan in place to look after those surge times when they occur in the ER.
Thank you. Order, please. I want to thank the Honourable Minister for that extensive and thorough answer. And I do want to remind everybody in advance of next week, please take the extra time this weekend to practice in front of a mirror with the 45-second clock so that we can try to stick a little bit closer to the 45-second timeline. Use 30 seconds to set up your question and 15 seconds to pose your question. The Honourable Member for Pictou East.
Thank you, Mr. Speaker. I rise today on a point of order. During question period today, the Premier accused me of standing in this House and saying that I wanted the Northern Pulp Mill closed. The Premier knows that statement's simply not true, so through you, Mr. Speaker, I ask him to either table documents to support it or to withdraw the statement. Thank you.
I would rule that that is a simple disagreement of fact.